We know that schools can safely reopen if community transmission is low. And even though we've had an uptick in the last few weeks, we know that we have flattened the curve here in BC.
This is a path we're going down that nowhere in the world, they don't know what exactly is going to happen. Is everyone nervous? Are parents? Sure, they're nervous. I'm nervous. Everyone's nervous when you're dealing with kids.
Welcome back to Power and Politics. A lot of Canadian kids and parents are learning this week what school will look like come fall. Today, British Columbia, as you heard there, announced a full return to class for students in kindergarten up to grade 12. A key part of the plan that they put forward are cohorts or learning groups meant to help limit the number of contacts staff and students have. Masks will also not be mandatory, but recommended when physical distancing can't be maintained. CBC News has also confirmed that Ontario will announce its plan for a return to school tomorrow. For more on getting students safely back to class, we're joined by a panel of 3 people, but because of the joys of pandemic TV, only one of them is available at this point. So we're trying to reach everyone else, but we've got Dr. Zain Chagla, who, of course, who we know very well on this show. Hi, Dr. Chagla. He's a medical director of infection control at St. Joseph Healthcare in Hamilton. Isaac Bogosh, as well as Caroline Colane, are going to join us as well as soon as we can reach them. So let me start off, if you don't mind, Doctor, with the concept of these sort of working groups or cohorts. We've seen some iteration of them elsewhere, particularly in some states. I've listened to some of their announcements. What do you think of the idea, and how do you think it might mitigate or could it mitigate the spread of the virus?
Yeah, they're part of the plan, and realistically, it's as Dr. Henry had said, there's still no way we can completely reduce the risk to zero of a school getting a COVID-19 case and having some local transmission. At least the concept of a bundled group that stays together mitigates that spread to the point where you're not necessarily having to go through contact tracing throughout the entirety of the school. You're really limited to that bundle of people who are, within that 2-meter range for a significant amount of time with that student that then get isolated as part of that. So you don't disrupt the entire school process. You at least have some semblance of normalcy if you do have some transmission within the school.
I think a lot of parents, this is an idea that was put forward for consideration for Ontario as well. And I'm wondering what you would say to parents who question, like, what happens if a kid in the cohort it tests positive, or a teacher? Does that mean, do you think like the prudent action would be for them, if you have if you're a parent of a kid in that cohort, then you just keep them home for 2 weeks? Like, what advice might you give there?
Yeah, it's similar to what happened in our hospitals. It's not necessarily just the positivity, but, where the kids were, if they were masked, especially, particularly in the older ages, if they were adhering to distancing appropriately, and if there's any other sick context in the class, you set up an outbreak investigation. If it's a single student who's been distancing well, who's adherent to the rules, then perhaps it's the couple of students in their direct proximity and perhaps a teacher, depending on that action. But if it's a small classroom or a small children classroom where we know physical distancing is probably not going to be the most optimal, then you probably are expanding that definition out to a bigger unit, or eventually in terms of that bundle. So it's going to be context dependent. And when there's those transmission events, they're going to work with public health to figure out which people need to be excluded or not.
The control room tells me that we have reached Dr. Bogosh. Hi, Dr. Bogosh. Can you hear me okay?
How's it going?
Oh, great.
I was here all the whole time. I'm not
okay, we're living the dream of pandemic TV right now. I should tell our audience that although they are very familiar with your face, your title, you're an infectious disease specialist at Toronto General Hospital, and you're joining us from Toronto. Dr. Bogosh, we were just discussing some of the concepts that BC put forth in announcing their plan today with Dr. Chagla, specifically the idea of a cohort. I was wondering what you could tell us about some of the... I feel like I'm reading something different every day, and I'm guessing most parents do, about how the disease is transmitted amongst kids, how susceptible they are to the virus. Like, what is the latest information that you're aware of that you could help us all understand?
Yeah, I think it's just important to understand, if we think of it in a very binary manner, can kids get infected, yes or no? Absolutely they can. Can kids transmit this infection, yes or no? Absolutely they can. The real question here is, to what extent can the little kids transmit this infection? Hey, maybe it's a little bit less compared to older kids. It's not entirely known just yet, but the fact that they can get infected, and transmit this infection means that when you put, several hundred of them into a box and shake it up, no one should be surprised if this infection is amplified in those settings, such as a school. And that's why all these major public health measures, such as physical distancing, mask wearing, hand hygiene, cohorting, that's why all these public health measures are really going to be implemented into the school settings to make it as safe as possible.
Let me follow up with you quickly on the mask issue, because we've heard from a number of different provinces. BC today saying it's not mandatory, and a lot of them have cited the difficulty kids might have wearing a mask for example, 6 to 8 hours a day, but that it should be employed when the same for all of us, when physical distancing can't be maintained. Do you think that's adequate?
I think I think we also have to be realistic here. I mean, what happens on paper doesn't necessarily manifest on the ground. And I think if they masks out like Halloween candy in the schools and at least give them the chance for success, they're doing something right. Totally appreciating that some kids won't be able to put a mask on, or will be ripping it off their face, or will be moderately adherent to it. I think something's better than nothing. And I appreciate in the BC model, they're budgeting several $1 million for masks. So it looks like they're going to be at least distributed. And I hope as many people wear them as can.
I want to ask you a question, Dr. Chugla, from a number of parents that I get who have kids who are, I'm not sure if the right term is high risk, but for example, have asthma or some sort of underlying condition. Obviously the plans that are being put forward are directed at the population at large, but what sorts of things should parents like that be considering, do you think?
Yeah, I mean, it's similar. And I think, those parents need to be conscious that their kids could get exposed to COVID-19. It's again, not a situation where we can eliminate the risk entirely. They do have to make a value judgment, particularly kids with very complex disorders where acquiring COVID-19 may not be a benign or minor illness, whether or not they do want to engage with the school system or use some of the remote learning opportunities. But by and large, most of these measures we're putting into place in schools should still protect kids with some underlying conditions, as long as they're adhered to properly, the distancing, the hand hygiene, and the spacing out more than anything else.
Dr. Bogosh, I wanted to get your perspective, and the school aspect of this fits into it. But as you know, on our watch during this show, we listen to Alberta and BC's press conferences almost daily, every other day now. And I really noticed in the past few days, in particular with Dr. Henry and Dr. Hinshaw, they keep getting questions, I think understandably, about, okay, we see cases going up. Does that mean things will reverse? Or at what point do you decide not to reopen schools fully? And both of them have replied, and I'm going to paraphrase what they're saying, by emphasizing that in the past few months, the definition of public health response has been very much focused on COVID-19 and eliminating or sort of increasing the capacity of hospitals to deal with it. But that focus, the nature of it being solely focused on that has to change, because there are so many other unintended effects, right? And we know that they vary from overdoses to mental health effects. And for kids, not being in school, there are a lot of effects there too. I'm just wondering what your assessment of that position is, and if you think it's sort of a natural evolution given everything that we've gone through, and if you expect it to persist even if we do see increases in various provinces.
Oh, I fully stand with those two public health leaders. I think they're spot on. I mean, public health has an enormous mandate. And of course, I mean, in the midst of a pandemic, that's taken center stage. But we can't ignore all the other significant public health issues that are in our community just because of COVID-19. Of course, it's hard to multitask, especially when during what I would consider, what I think many Canadians would consider when we were in crisis mode in March, April, and May. But as cases have come down, of course, it's extremely important for these public health leaders to really tend to other pressing measures like the opioid crisis, as you point out, and among many other public health measures. Sure, but kids going back to school, of course that's important. And, it's not just public health that's really going to be involved with that. There's several different stakeholders at the table that will help facilitate that in a safe manner. And I think I was pointed out earlier on the show before I got on, the best way to do this is to get the rates of COVID-19 in the community as low as possible, right, because that will just lead to a more successful opportunity in getting kids back to school. Okay, I'm going to leave it there. I'm out of time. Thank you so much, both of you, for your time. Appreciate your patience with our
wonderful technological issues. Thanks, Dr. Bogosh and Dr. Chugla. I want to mention that we were not able to connect with Caroline Colane. She's a Canada 150 Research Chair in a whole host of specialties at Simon Fraser University, but we're going to try to get her back on the show as soon as we can. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.